So the key findings of our study, which was looking at the effect of tramadol on long-term dependence in patients with an acute episode of pain, was that the patients who received tramadol actually, to our surprise, did not have lower rates of long-term opioid use, but actually had slightly higher rates of going on to long-term opioid use after an acute episode of pain like surgery. In our practice, we obviously do a lot of major operations here, and some patients do require opioids, but we're continuing to work on non-opioid based pain control after surgery to try to limit the amount of opioids we prescribe and really only prescribe opioids when we have to. However, as we know, some patients will require opioids after surgery, but what we know now is there is really no safe opioid, and tramadol is not a safe alternative. It is an opioid. It has very real risk. It may even have slightly higher risk than some other opioids. So really, it's important that physicians talk to the patients and have a meaningful discussion about the risks and benefits of opioids if they are needed, and tramadol needs to be thoroughly discussed in terms of its long-term risk of dependence before starting a medication like that. Tramadol is a unique opioid, not only in terms of its mechanism of action, but also how we viewed it in the last few years. Some countries actually do not consider tramadol a controlled substance currently, like Canada, although they are reconsidering it. And some countries, like the US, actually consider it a less risky or lower scheduled opioid compared to other narcotics, meaning that tramadol is currently a Schedule IV opioid versus other opioids like oxycodone or Schedule II, meaning that the government considers those at higher risk of abuse and long-term dependence. However, what we found is, in fact, really tramadol is not actually any lower in terms of its rate of abuse or long-term dependence, and therefore probably should be classified in a similar level. Our goal is really to effectively manage patients' pain after surgery with the least amount of risk. We consider long-term dependence or side effects from opioids after surgery a complication from surgery now. We want to avoid those complications. We certainly don't want to leave patients in pain, but we want to control their pain with the most effective and safe means possible. Hopefully with non-opioid medications, but when needed with opioids, but we want to make sure that when we pick an opioid, it's the best option for the patient.